Hello and welcome to this episode of Focus On with me, Yamokhadza Mosepele. Today marks the second day of coverage at the Africa Health Exhibition 2024 hosted in Cape Town. The annual event gives a platform for industry leaders, policymakers and healthcare professionals from across the continent to discuss some of Africa's most pressing healthcare issues. So thank you so much for joining us and thank you for your time. This is the second day of the Africa Health Exhibition hosted in Cape Town. I want to know from your viewpoint, what are some of the key issues you'd like to see addressed at this year's conference?
All right, thank you very much for that question. So it's been 2 wonderful days already at the Africa Health Conference, and we already began conversations to address some of those issues. Last year, there was a WHO resolution on strengthening diagnostics capacity globally, and Roche, we are part of those who are really advocating and supporting the implementation of this resolution. So the resolution tries to address most of the challenges across healthcare, narrowing it down to Africa. There's a bit of a gap when it comes to healthcare financing and funding for diagnostics. So that is one thing we're trying to see, how do we address that in collaboration and partnership with government, the private sector, and even non-governmental organizations. When you look at financing for healthcare and you look at the budgets, right? Even though we have diagnostics enabling decision making for 70% of clinical decisions that are made in healthcare, you find funding of diagnostics to be less than 5%. So what we're trying to do is to see how do we get governments to have a shift and have a balance in terms of the funding and financing of diagnostics versus treatment. We already began conversations looking at how to have conversations with global, regional, and local stakeholders in terms of partnerships that can drive that effort.
So you've briefly touched on the financing challenges that are endemic to Africa's healthcare systems. I want you to expand a little bit more, as you've mentioned, on how government and the private sector can partner to, one, lessen that gap and also come up with innovative solutions to ensure there's more development across the continent within its healthcare systems.
So thank you very much. Let me use that opportunity to quickly share with you our ambition at Roche Diagnostics. So Roche Diagnostics in Africa, we have an ambition to increase access to in vitro diagnostics tenfold within the next 10 years. And this journey started from 2021. So our expectation is that by 2031, we should have 500 million people on the continent having access to our innovative diagnostic solutions annually. We can't do this alone, but we need to do this in collaboration and partnership with multi-stakeholders, including government at global, regional, and local levels. Now, these partnerships will be very key because there are huge gaps that need to be cleared and covered to increase access to healthcare and enable UHC. These partnerships will have to facilitate ensuring that we have sound infrastructure, that we have access to financing, we have smart regulatory systems, and also build capacity of the workforce on the continent. So one key area for government to really partner with private sector is in terms of regulation. How do we ensure that we have smart regulatory systems that help to fast-track access to innovative solutions real-time on the continent? Today, we have most of these solutions being developed in Europe. Once they are registered in one African country, how do we make sure that we don't need to register in all 54 countries before patients can have access in those countries? So there's need to look at the Africa Continental Free Trade Agreement, and within the context of that, see how we can really fast-track regulatory processes. We know there's work going on by several agencies, especially under NEPAD and Africa CDC. Through the AMA, they are working on seeing how do we harmonize regulatory systems. That is one way the private sector is already collaborating with the government to see how we fast-track that.
I just want to touch on the significance of the Africa Health Exhibition being hosted in Cape Town. What are some of the observations that you've seen and your sentiments towards it being in the mother city?
So we are very happy that Africa Health has moved to Cape Town. We really like to demonstrate the Western Cape's capabilities in terms of the private sector companies that are able to produce innovative goods and services in the health and life sciences space. We've also got very interesting universities here with 2 prominent medical schools and a dentistry school. And so we're very happy that we can get to show off this innovation that both the universities and the private sector represent. And lastly, to be able to bring the Western Cape Department of Healthcare also into the picture and then engage with private sector in a direct way. So we're very happy to have it here, and very happy to have the event in Cape Town.
And now, taking into consideration the current economic and political environment, what is the merit behind a partnership between government and the private sector to foster a more conducive and fair healthcare system?
So we obviously in South Africa are in a tight fiscal position at the moment, and so it really is key to involve the private sector more and more to provide not just private sector goods and services, but seeing what the private sector can do to assist in the public services space. So often companies can bring a unique expertise to produce goods and services in the healthcare space that are more cost effective sometimes, and can be provided to a wider range of citizens. So that is ultimately the goal and the hope, that we hope to see private and public sector collaborate to bring new technologies, to bring innovation, and hopefully to do it more cheaply so that more citizens can receive healthcare across the country.
Now, you've mentioned the merit or the benefit behind collaboration. I want to circle back to today's event, which has gathered a number of industry leaders from across the continent. What are some of the key issues you'd like to see addressed or tackled within the duration of this conference?
So I think a key point for us is, how can we get more locally produced goods and services into the local healthcare system, whether it's the public or the private healthcare system? So if you look around the halls today, you'll see a lot of delegations from all over the world, from China, the US, Germany. We know they produce very good goods and services, but what we'd love to see is more African solutions. So home-based companies, whether they're from the Western Cape or whether they're from South Africa or other countries in Africa. I think the key thing is, how do we get more hospitals, more healthcare providers using goods and services that are produced in Africa, where we understand our own issues just a little bit better, where we understand the need for cost-effective use of resources, and where sometimes the context is slightly different to a European or a North American environment. So we really hope that this conference and exhibition provides a showcase for more local companies on the African continent to sell their goods and services to those buyers of those products and services. Thank you.
And lastly, I just want to touch on your opinion on the future of healthcare. What is your outlook for 2025 within South Africa's healthcare system?
So we've obviously got the drive of technology across the world. Digital transformation is driving a lot of businesses, and that's going to be a key component of healthcare. So digital healthcare solutions, whether it's on an app, whether you're using artificial intelligence. So that's very much the future of many parts of the global economy, and healthcare is no different. So we'll see a lot of more of those types of companies providing solutions in that space. I think the other thing that's coming up in the future is how South Africa deals with the national health insurance. And we very much hope that continues to bring more local goods and services into circulation, into the healthcare system, and also so that both private and public can work together to ensure that as many citizens get as cost-effective healthcare as possible.
We've made way here at the Africa Health Exhibition, one of Africa's largest healthcare gatherings. I understand your company, Siemens Healthineers, is also in attendance. Can you just let us know what are some of the key challenges you'd like to see addressed through today's conference?
Yeah, good morning. So the key challenges in Africa actually have not changed over the last couple of decades, which is firstly capacity building in terms of personnel and infrastructure, and secondly the funding of healthcare, and lastly the technologies that are appropriate for the African environment. These to me are the key challenges that I would like to see addressed in this conference here.
And you've mentioned that these challenges are not new or unknown. I want to touch on particularly capacity building and funding. In what ways can governments partner with the private sector to ensure inroads are being made in that front and foster a more competitive and fair healthcare sector?
Yeah, I would say firstly, the key thing is more in the training area. and also to prevent the brain drain, so to speak. Yeah, because what happens is a lot of African academics and clinicians, they get trained and they move on to the more developed countries. So we forever, like most of these countries, have become training academies. So it would help if both public and private sector help in the funding of these professionals, and then that also diplomatic channels are opened to make sure that the clinicians and academics do stay in the countries where they belong. I know it's not easy because of the environment that is more attractive for them overseas. So that's one thing. Then the other area in terms of infrastructure and management of these facilities, a good example is Nkosi Albert Lutuli Central Hospital in KZN, where we were involved as Siemens Healthineers for the last 20 years. It is a state-of-the-art hospital, and we've been involved in it for about 20 years. And this is one example of a very successful public-private partnership. So I think initiatives like this, if they can be scaled up, will take us quite very far. Yeah.
I also want to go back to your initial point where you've just touched on the threat to human capital and the challenges associated with brain drain. Another challenge within that regard is the influence of AI. I want you to just touch on how Siemens Healthineers is approaching that as well within their company strategy.
Well, it's an interesting one, AI, and it's very, it's a big talk around this topic. We know it has got great potential in terms of augmenting healthcare, in terms of, for example, clinicians can then focus on their core competencies, be it in telemedicine, be it in diagnostics. It helps doctors, clinicians to arrive at a diagnosis much faster with this artificial intelligence. However, what we observe, I'm not a politician, but the geopolitical tensions or geopolitical collaborations have got an impact, sometimes positive, sometimes negative, in the African continent. By that I mean because a lot of African countries rely on foreign aid, and this foreign aid is also attached to your collaborations, etc. And also regional stability is also critical, because the countries with less stability, they struggle more with healthcare than those who are more stable.
And that's how we wrap up this episode of Focus On at the Africa Health Exhibition 2024. From me, Diagnostics and the CNBC Africa team, it's goodbye for now.